porn is stealing your time, draining your energy, ruining relationships, and robbing you of your power? It's time to take your power back. Eric Zuzak tried 12-step programs and felt powerless when they didn't work. He then discovered the power of mindfulness in combating addictions. Porn Talk is about reclaiming your power to end your porn addiction. It's how Eric transformed from powerless Eric to powerful Eric. Ready to break your porn addiction? Learn from Eric, the powerful Eric. Here's your host, Eric Zuzak.
Welcome to Porn Talk. This is Powerful Eric. This show is not just about breaking addictions. It's about breaking belief systems. We are bound by self-imposed and societal chains. Break those rusty, nasty, heavy old chains and get empowered right now. Today, we have a very unique guest on the show. She is a sex mechanic. A what? Yes, you heard that right. She is a sex mechanic. She will tell you what that is. Hina Sheth is the founder and clinician at Rebalance Physical Therapy. Rebalance Physical Therapy is a pelvic floor and orthopedic physical therapy practice based in Pennsylvania. She's just coming off a recent win giving a great TEDx talk. Welcome the sex mechanic, Hina Sheth. Welcome, Hina.
Thank you so much for having me on.
Absolutely. So let's get right into it. What the heck is a sex mechanic?
I know everyone kind of wonders that. So I'm a physical therapist, both an orthopedic and pelvic health or a pelvic floor physical therapist. And what I treat is essentially issues down there. And that can actually have an impact on the sexual organs and how those sexual organs function. And so essentially one of my roles is a sex mechanic. I kind of say I'm a body mechanic essentially, because that's what physical therapists are. But in this particular case, I'm a sex mechanic because once I work on people, their sex lives gets better. So in a nutshell.
Awesome. The guys, a lot of the people listening to this, obviously, I mean, the show's not just about breaking addictions, it's about breaking belief systems, but pornography, porn addiction, excessive masturbation. What is some of the challenges that can cause to the physical body? Specifically, let's talk about the male anatomy. What can happen if someone is excessively using porn and masturbation?
Yeah. So with, any type of erection and orgasm, essentially, what happens is there are a few pelvic floor muscles in both men and women. But in men, what happens is these particular pelvic floor muscles, and there's 14 muscles in the pelvic floor. There's a few that actually help to help blood flow into the penis. And between vascular flow, meaning blood flow, as well as this muscle pumping action when the muscles are actually contracting, it creates an erection. But if you do that excessively, just like if you go to the gym and I tell you, hey, I want you to do, 100 bicep curls and don't stop, for a while, your muscles, like, what do you think is going to happen to your biceps? It's going to feel pretty darn terrible.
Yeah.
And then think about the recovery of that muscle. Okay, so now most of us have been to the gym and felt that soreness, right? It
Mhm.
lasts for a couple of days. And if you do a really intense workout, it can last for a week. So you need that muscle recovery time. You're not going to go to the next day to the gym and do another 100 bicep curls.
Right.
So the same idea is behind these muscles. When they're contracting, when you're having an orgasm or an erection, you need that recovery time for these muscles. So if you do this over and over and over again, kind of think about like, I wouldn't go to the gym and do, bicep curls every single day, several times a day. Your
Yeah.
muscle's not going to have time to recover. And so then
Yeah.
that muscle becomes dysfunctional and it becomes problematic.
Right. And I can personally attest, well, I, I know someone who has been deeply, deeply, as we spoke about before we started recording,
Yeah.
affected by this pelvic floor problem. Like this literally like changed his life in a bad way from this challenges with this pelvic floor pain. I never even heard the term, or the pelvic floor. I didn't even know what that was. So maybe, so I'm saying this to point out to everybody, like this is very real. Like this is a very serious program that can disable you really. And so, excessive porn with masturbation can be a serious problem, is a serious problem. And I know of it from someone I know very well. And so maybe you could tell, like, what is the pelvic floor anyway?
Yeah. So the pelvic floor, and most people think if you know about the pelvic floor, they're like, oh, it's one big muscle. It's not. It's actually 14 plus muscles. There's actually a debate about it, whether there's 14 to 18, who knows. Um, but there's a debate on how many muscles there actually are. So I want everyone to know there are several muscles that make up the pelvic floor. Okay. So and I have a kind of a picture of it, but
Mhm.
these muscles are basically located inside your pelvis. You cannot see them from the outside. You can feel some of them from the outside, but really they're muscles that you can't directly see, and oftentimes the deeper ones you cannot touch from the outside. And they're a group of muscles that attach essentially from one hip bone and pelvic bone to the other. They also attach to the bottom of the tailbone, which is right in through here. We're looking at the underside of the male genital or male pelvis. And then they extend up into the pubic bone. So it kind of forms like a hammock. And if you end up watching my TED Talk, I have a better picture of it. But it kind of forms a hammock inside the pelvis that supports the rectum, the bladder, and in females the uterus. But in men, it gives support to the sexual organs as well. And so, if there's any type of problem in these muscles, either they're too tight or they're too weak, or there's a combination of the two, they can actually not only cause you erectile dysfunction, pain, they can cause changes in the penis, as well as the musculature in that area. It can change the texture of the penis, and that's something called we'll talk about a little more. That's There's a term for that. And actually, it can also end up giving you hip and low back issues as well.
Mm.
So,
Maybe you could go into that a little bit. So, like with back issues, because that's a issue with a lot of people.
yeah,
So, really, like, because I never even thought of this. So, excessive masturbation could lead to lower back pain.
it can. And again, it's one of these things that you kind of have to think of as if we're directly saying, okay, masturbation can potentially lead to hip and low back issues. You kind of have to think of it this way. Going back to if you're at the gym and you're lifting biceps, like, or doing bicep curls every day, several times a day, right? If we look at like the biceps, this muscle will become tight and problematic. Well, if this becomes tight and problematic over time, if you can't use now your biceps as well, what are you going to do? If you had
You
to
have to
like
compensate for it.
yeah, you gotta compensate up here for it. You probably have to like, if you can't like bend and extend your elbow very well, then you're probably gonna have to do other things around the wrist or the shoulder to compensate for that problem because it's tight and dysfunctional. So the same idea, these pelvic floor muscles attach to both hips, the tailbone, and to the bottom part of the spine. It's called the sacrum. And if that now shuts down and isn't moving very well because of tightness, it's going to throw the alignment of these bones off. And then the lower back is going to have to compensate, as well as you're going to have to start moving differently. But not only that, oftentimes what we find in men and women that develop pelvic floor issues is that they also start to compensate they also have other muscles that start to become a problem too. So some of these other problems can be muscles inside the abdomen, deep in the abdomen,
Mm.
muscles deep into the front of the thigh, muscles on the inside of the thigh. And they can also, weirdly enough, change the way you're breathing.
Mm.
And so when you start thinking of these combination of, oh, wow, these muscles can actually affect or be involved with all these other muscles, now you start to see, okay, well, if all of these things can now affect the spine, it can affect the hips because it starts to pull and tug on the bones that these muscles are attached to. And then all the compensation starts to change. Compensation meaning other muscles now that have to start getting involved because these muscles aren't doing what they're supposed to, or they're not keeping the joints that they're attached to relaxed.
Oh my gosh, I just had this thought because I've never really thought about this pelvic floor thing until someone I know knew had it. And then, like with pornography,
Mhm,
a lot of the pornography, like hardcore porn, there's a lot of anal sex. And I'm
mhm.
thinking, oh my gosh, this pelvic floor thing, like this is probably, excessive anal sex. Probably, I would imagine, can cause some very serious problems.
Yeah, well, and what I would say is with anal sex, I would say more so what it could be also, and yes, maybe because if people are tightening up quite a bit, or let's say if they find it uncomfortable, but for some reason there's it's erogenous but uncomfortable at the same time, and there's a lot of clenching going on, that can tighten up these muscles for sure. And over time, perhaps that can end up causing muscle tightness down there. And that for many people, sometimes with excessive anal sex, things like that, this can cause mild trauma to this area. People can develop hemorrhoids and fissures meaning little cuts in the rectal canal.
Yeah.
And that oftentimes can then lead to people having to tighten and clench to kind of be protective of this area. And then that can lead to tightness in the pelvic floor. So it kind of circles all back around. And it's not uncommon for people to have like hemorrhoids and fissures that come to us, and lo and behold, they have tight pelvic floor muscles.
Yeah. So one of the main issues, it seems like every other guy that contacts me that's addicted to porn and is ready to stop, it's because they have porn induced erectile dysfunction.
Yep.
They've watched so much porn that they are uh, no longer able to get it up with a live breathing human being unless there's porn playing at the same time. And some guys, it's, just a like a psychological thing. And
Yeah.
other guys have actually, hurt themselves. So
Yeah.
can you speak to the porn induced erectile dysfunction at all?
Yeah, so I think you're right, there's 2 components. I actually watched a talk on this, not so long ago about the psychological effects and the dopamine and how you need more and more of that dopamine release to kinda keep things more exciting from a brain standpoint. So that's one thing. But the other piece, what we find is that the erectile dysfunctional piece can come from things that actually lead to something called hard flaccid. So, hard flaccid is where, remember when I was talking about how with an erection, you have blood flow that needs to go basically into the penile shaft, and these muscles kind of help the pelvic floor muscles that kind of help pump that blood flow up. Well, if those muscles become tight over time, then you actually now can't get the regular, those muscles start to become dysfunctional. They can't work as well as they used to. So then what ends up happening is essentially you don't get this good blood flow into the penis, but you almost get like a congestion. And that can cause something called hard flaccid, where the penis can essentially stay shortened. There's texture changes. It feels like it gets hard, but hence the term hard flaccid, because you're not really getting a full erection, but the penis is somewhat hard, but it's not fully erect.
Yeah. And you said there's some type of congestion Is that what you said? That sounds awful.
Yeah, well,
Sounds awful.
it's
Congestion. I've got,
basically
excuse me, honey, I've got some congestion in my penis. It's like, oh,
Yeah, I know. I feel bad because for the men who are suffering from that, it really becomes, very just depressing. Almost sometimes, it's depressing. I've heard men say that it almost feels like I'd be better off, not living because this
ooh,
is, yeah. So it can, for some men, it can become really psychologically damaging and so it it really is something that you want to be aware of. It doesn't happen with all men, but this can be something that you want to look out for. And I definitely have many, many, many men contact me about this going on. And
mm,
that is a combination of this muscle tension that overly develops in the pelvic floor, and it causes these changes. Now, the other pieces that I know you had mentioned, that not necessarily that you've heard of this too many times, but many of my men have a lot of pain and nerve dysfunction down there as well. And
mhm,
I'll speak about two things regarding this. Number one, same idea of when we were talking about before, where these muscles excessively work. And then again, they don't have the recovery time. And so when these muscles stay tense and tight, they can actually become spasmed, meaning they develop tension and tightness. And there's something called trigger points that can develop in these muscles. And these trigger points, if you can imagine like a knot in a muscle.
mhm.
Um, and that knot over time, again, doesn't get good blood flow. And I talk about this in the TED Talk where, I kind of say it's equivalent of a fist. That fist doesn't allow, you can imagine a tight fist doesn't get good blood flow. Well, these
Right.
knots don't get good blood flow either. And if they don't, they can become painful and problematic. And then on top of that, if all of these muscles don't have good flexibility, you've got little nerves that go through these muscles too. And those nerves become unhappy as well. And if they become unhappy, that now you're starting to have pain and you're starting to have stiffness. And oftentimes men will say, it feels like there's like a vice-like grip in my pelvic floor.
Ooh,
And for some men, and they may not even realize this because I know, many of your audience is trying to get over porn addiction, but I
right.
have a lot of men who don't feel like their issues are coming because of excessive masturbation. It's only until I link it back to what's been going on, or I ask them directly, how many times do you masturbate a week or a day? And then they're like, oh, I didn't know this was what was causing my problem.
Mm,
And we'll talk about what those symptoms can be, you know, a little bit down the line when I tell you what kind of other symptoms people can end up with, because maybe they can link it together.
yeah.
Or maybe someone's listening to this talk and they're like, "Oh my god, my friend has this problem." Or I don't know, maybe they know of a family member that has this issue, that they might be able to pass the knowledge on to.
Yeah. So with the, if we could go back to the hard flaccid, I find that interesting. So g- tell us a little bit more about that. So what are the symptoms of being hard flaccid?
Yeah, so hard flaccid. And oh, and I forgot to tell you the second part, which I'll go back to.
Okay.
The second piece of um, what excessive masturbation can cause. But hard flaccid is basically where the penis can actually um, it stays shortened and hard, almost like there's an erection that's like anytime they're wanting to have an erection or an orgasm, the penis stays small and hard versus erect,
Right.
elongated.
Right.
It feels like a normal blood flow going on.
I see.
Whereas with
Okay.
hard flaccid, because the blood flow is trying to get there, but it's not actually allowing good blood flow because of this tension that's developed, that can now, you can imagine, cause changes in the tissue around the penis as well.
Right.
So sometimes, people will say, I feel there's numbness. Maybe there's a lack of sensation. Sometimes they feel that there is some pain that goes along with it. But really, it's like they feel like I feel like my erections are not as hard. They feel soft. They're somewhat hard, or my penis stays short.
I see.
Yeah. Those are
A-
kind of the symptoms.
And then you said there were some other things about from excessive um, masturbation.
Masturbation, yeah. So the first part was I was talking about how pain can develop in these little nerves and trigger points and things like that. And we'll get back to trigger points in a minute. But the second piece of it is many men who are addicted to porn, you know, will start to think of other things that they might be able to use. So oftentimes what I hear is men using penis pumps,
Hmm.
and they use them and they don't use them correctly, or they are using anything for penis pumps, or even for trying to not only elongate their penis but also just as a pleasure form as well.
Hmm.
And that can end up causing traction injuries to the nerves in this area.
Hmm.
So, they can cause, and hopefully for most men, it doesn't cause long-term issues, but I know for some men that I've spoke to, it can cause a lasting effect. But you wanna be careful of using, penis pumps and elongation tools for those purposes, because if you don't use them in the right manner, and I do know sometimes they are, medically, they're medically recommended, right? And that's different.
Wait,
But if
they're medically
med-
recommending a penis pump?
well, it's not a penis pump, but a type of traction device for certain
Okay.
medical conditions.
Okay.
But if you're not using them for a medical condition that's prescribed by your physician for a particular medical problem or a medical, issue, then if you're just using them as a tool for improving cosmetic things down there or as a pleasure device, you really got to be careful with those things, because they can end up causing more harm than pleasure in the long term.
Yeah, I can imagine. So let's segue a little bit into we're talking about some of the challenges with excessive porn and masturbation, but what are some of the solutions? So, uh, if you could address that.
Yeah. So I would say if you're dealing with any issue where you're having hard flaccid, so physical changes in the penis, the tissue around that area, if you're having any pain, if you're having any episodes of on and off numbness, sensation changes, tingling, and we'll talk a little bit more about this if you are up for it, is any type of issues, even that seem like prostate pain, almost urinary changes as well, but you're not quite connecting them to, could it be excessive masturbation? Those are when you can start to think, maybe I need to have these muscles checked out. And I would honestly say if any male is having erectile dysfunction that also feels like it's related to any tightness around their hip or back as well. Like if they're noticing, like, ever since I've started masturbating excessively, I'm also noticing like I'm stiff around my hips. I'm having urinary changes. I'm also having more maybe constipation issues, or even low back issues. I would start to think, maybe my pelvic floor muscles are becoming to be a problem, because again, you may not relate the low back and the hip and these urinary changes and these colorectal issues like fissures and hemorrhoids all of a sudden developing to excessive masturbation. There's a psychological component, but then the physical component is going to be these things as well as hard flaccid.
Wow. Let me interrupt you for a moment. This is a heavy topic, and I can't help but think, getting up the next day, holding your back, and it's like, oh man, I was really going at it last night. And it's I really went at it last night. I'm holding my back, and I never would have put that together. So that's really
Yeah.
interesting to know.
Yeah, and sometimes it's not so much like, "Hey, I had I excessively masturbated yesterday and now my back is hurting." Sometimes it's these subtle things that develop over time, because often I would actually ask you, like, those who have addiction to porn, it's probably been years that they've been addicted to porn.
Oh, yes.
Yeah,
Usually since they're kids.
exactly. So some of these things, I kind of call it like a layering effect. Sometimes men have had these issues into their teens when they first started masturbating. An injury from playing a sport, right? They injured their low back, they injured their hip. They now, I don't know, go to college, start driving. Maybe there was a car accident here or there, fender bender, another couple of injuries forms another layer. Then they now, graduate and they're at a desk job and they're sitting all day. So when you're sitting, you actually sit on your pelvic floor muscles, and these muscles don't have good blood flow if you're sitting on them all day, right? If someone was like you know, sitting on muscles and there's compression, you're not getting good blood flow. And now here comes, the stress of life, and you're probably masturbating a little more because for many men you're probably relieving, masturbation is a form of stress relief. And or maybe, here comes the pandemic and everyone gets to work
Mm,
from home.
yeah.
Right? And I saw a lot of that where people are like, "Oh my god, I got addicted to porn from the pandemic because I
Right.
had all this time." And so you're talking about these little layers that end up forming. And
Mhm.
so for many men, when I talk to them and they say, "Hey, a lot of my symptoms came on because I started excessively masturbating." When I start really talking about the history of their life from when they were younger and injuries and their posturing and the things that they do, are they runners too? You're now talking about muscles that have already been tight, have because of all these things. And now masturbation just spills this over the edge. And
Yeah.
now they're developing erectile dysfunction, but they may also be having all of these other things going on, but they don't realize, oh, it's tight musculature as well that may have kind of also kind of caused this erectile dysfunction to a certain extent as well, along with the psychological issues that can develop from excessive masturbation.
What do you say to someone that comes in that does have erectile dysfunction? Like what can you do for them? Somebody that has erectile dysfunction.
Yeah. So, typically, when someone comes into our office, we are looking at everything from looking at their posture, because believe it or not, the way their posture is will tell us a lot about which muscle groups are tight. So we're looking at their posture. We're looking at the alignment, looking at bony alignment of their spine, of their pelvis, of their hips. That's going to tell us again which muscles down below are pulling on what parts of the bone. Then we go to touching all of these muscles. So we're looking at muscles of the abdominals. We're looking at the deeper abdominal muscles. We're looking at the low back muscles. We're looking at all the muscles around the hips, the buttocks, the perineum. So all the muscles that basically on the outside go right up and right under the penile shaft. So we're looking at all those muscles because there are a bunch of pelvic floor muscles you can actually touch from the outside.
Mhm.
And then we're actually doing, with their consent, as long as they're okay with it, we're doing a exam of the internal pelvic floor muscles. And that is a rectal exam that we do with a
Yeah.
finger. With a finger. So it's not that bad. It's actually with a finger. And most people, they think about it and they're like, oh my God, someone's going to do that. But actually, when you have to go to your urologist and have a prostate exam, that is much worse than having a pelvic floor exam by us.
Hmm.
Most men don't, I mean, it can be uncomfortable if those muscles are really tight. And that actually tells us something. If I do a pelvic floor exam and someone is like, oh my God, that's really painful. I usually say, okay, we don't really even need to do anymore. I already know these suckers are tight. But if I can do a pelvic floor exam and they're actually able to relax through it, and then it's just, really being able to touch some of the deeper muscles and be able to tell which specific one or few is it that's the problem, then that kind of gives us an idea of, okay, how bad is it? Is this person have severely tight pelvic floor muscles, or do they have just mild pelvic floor muscle tension? And my guess is for those who are excessively masturbating, even if you're not having all these symptoms that I'm talking about, but you might be kind of having one or two, I bet you many men actually have tight pelvic floor muscles and they don't even realize it.
So for those that don't even realize it,
Mhm.
that really don't aren't having any major symptoms, what's something that we could do to be proactive
Mhm.
to make sure that we don't end up with some pelvic floor problems and or erectile dysfunction?
Yeah. So, I mean, number one, you really got to get the porn addiction under control because remember, these muscles need recovery time, right? Just like the biceps needs recovery time, these pelvic floor muscles need recovery time. And one of the questions people ask me is, well, how often should I be masturbating? Is there a norm? There's no study out there that I'm aware of that says, oh, this is the norm amount of time to masturbate. This is the norm amount of time, that people should be, giving recovery time. I think
Right.
everybody's body is different. Your
Hmm.
DNA from one person to the next is different.
Hmm.
One person that can excessively masturbate and never develops a problem isn't the same for somebody else. We're individual people and human
Right.
beings. So we have to keep that in mind. But one of the things that I will tell you is as you are trying to get over the porn addiction, okay, um, that I would say practicing releasing these muscles yourself is going to be important, so that you can. It's almost like if the biceps muscles gets a really good workout and then it becomes a little spasmed. Well, wouldn't it be a good idea to probably think about stretching it, right?
Yeah.
Maybe.
Yeah.
Okay. So what we want to do is we want to do a stretch of these pelvic floor muscles, and you're
I'm
probably
envisioning some really
like,
strange
"What
stretching here.
how are we gonna stretch these muscles?" Well, an easy thing, and this is why initially when I was talking about the diaphragm, I don't do you remember I talked about the diaphragm? The
Yeah.
diaphragm is a muscle inside your body that is responsible for our breathing. Okay, for those of you who don't know what the diaphragm is, it's a big dome-like muscle that sits on the inside of your rib cage, and every time you breathe, that diaphragm actually depresses, it goes down. So as you breathe in, your diaphragm relax or it depresses down. Every single time it depresses down, what ideally should be happening is your pelvic floor muscles should be relaxing. So if you guys are in a car and you're listening to me on the radio or maybe you're envisioning me, I want you to imagine taking a breath in. Or not even imagine, take a breath in through your nose. And what you should ideally feel is there's something down in the perineal region in between the bones that you are sitting on in the perineum that feels like it kind of elongates a little bit. So as you take a breath in, almost like you're initiating uh urinating. You're just initiating like you're going to go to the bathroom.
Hmm.
So as you take a breath in, you should feel like something elongates. And if it does, that is you using your breath to actually stretch the pelvic floor.
Huh. I've never had that. I've never like focused there. I was doing it while you were saying that.
Yeah.
That's really unusual. Until I put my focus there, didn't even realize that was happening.
Yeah. And most people, when I tell them to do that, they're like, what? What are you talking about? I have no idea what you're talking about. But this is something that, this is not something that we're taught, to do. So you really have to initially be mindful of it. So going back to your mindfulness techniques, for those
Yeah.
of you guys who are using that to get over
Yeah.
your porn addiction, maybe try adding the breath work of, hey, breathing in. And as I breathe in at the same time, imagining like I'm letting go, like I'm peeing. Okay, so do this on an empty bladder. um, but imagine like you're just letting go of these muscles like you're trying to pee. And
So if you don't mind,
yep,
let's do this. Like I'm one of your clients,
yep,
and you're walking me through this. So and I don't know what I'm doing. So we're
yep,
and just to be clear, the goal here is to relax and stretch our pelvic floor, and this will hence to help prevent erectile dysfunction and or other pain. Correct.
yes.
Okay.
Well, it'll help. Yes, it'll. Let's put it this way: it'll do the best job for the best bang for your buck.
Okay. So I'm your client here. I'm ready.
Okay, so you can do this by closing your eyes, so it allows you to concentrate on your pelvic floor more.
Yeah,
But I
nice.
want you to imagine taking a breath in through your nose, and imagine that you're sending that breath down to your belly at first. So we're going to send that breath, send it down to the belly. And I want you to imagine that your belly is actually expanding forward and to the side, all around as you take a breath in. And now easily take a breath out. So you should be able to feel air going into your abdominals and then coming back out. So as you take a breath in, you're filling your belly with air, and then you breathe out, you're allowing that air to come out of your nose. Now we're going to go down further. I want you to imagine taking your breath in, and we're going to take that breath down to your hips. Can you imagine that you're taking that breath in? You're allowing imagine that your hips are expanding to both sides of the room, or maybe if you're in your car listening to this, um, imagine that now your hips are expanding with air every time you take a breath in. Now I imagine, if you take a breath in, that now you're sending that breath down through almost like your sit bone areas, like your tailbones. So almost imagine like a diamond between the two bones that you're sitting on, your tailbone and where your penile shaft is. Try and imagine taking that airflow down to that area, and imagine that you're trying to make that diamond bigger as you breathe in. And ideally, what it should feel like is it's almost like you're letting go as if you're trying to pee. And you should feel that something is actually bulging or expanding when you take a breath in. And that is pelvic floor relaxation. So that is, you are getting those muscles to stretch a little bit. And that is helping to help those muscles get better blood flow, help recover and repair.
Wow. I am blown away. And one of the reasons I'm blown away is because I'm a big advocate of breath work, huge advocate. And now I'm even more so the importance of, well, being mindful, meditation, breathing, breath work. These are all tools that we can use either to overcome a porn addiction or to prevent porn-induced erectile dysfunction or just to relieve some type of pain. So that's awesome.
Yeah. And if you find that you do this and you're having a really hard time even doing this, for those who may not have any of these symptoms going on. And I forgot to mention, if you do have problems with this, oftentimes people will say, I feel like my urine flow hasn't actually been optimal. Like they feel like they have urinary retention, or they feel like they can't quite relax quickly to have a strong urine stream. That might be
Hmm.
another symptom that is not a pain symptom, but you're kind of like, wow, why is it with this erectile dysfunction? I'm also peeing differently, or my stream is veering off to one side, or constipation is another thing. Because when these muscles are tight, they don't allow things to flow, right? Whether it's out of the rectum, out of the penis, either the urethra or semen wise, right? So these are the things that these tight muscles can also manifest as.
My
Um,
stream, honey, my stream is just not straight lately.
yeah,
My stream's coming out diagonal,
I,
and I can't help. I'm a big proponent, fan of Bruce Lee. You can see me
I,
behind here on the wall. And Bruce Lee had this saying, be water, my friend, be water. Water becomes the cup. And So, but he doesn't say BP, my friend, or semen, my friend. He says be water.
Be water. Yeah. So basically, if you have any of these things going on, this is a real quick, nice, easy exercise that you can do, following masturbation or even having sex, that can just kind of help these muscles recover a little bit. But what I like to add is if you are having any of these, oftentimes, like in our clinic, this is like one of the first things we teach our patients, as well as in our course. So I forgot to mention, we have an online course of how to start working yourself on all these tight muscles and tight pelvic floors through everything from breath work to stretch to release work. But all of that can help to kind of start getting all of these things under control. So yeah, I think was that the question you just asked? I totally forgot the question you just asked.
I don't even remember what my question was. I just remember you saying that about correcting your stream.
Oh, yes, yes. Well, that's because when these pelvic floor muscles are tight, they can affect how things flow out of you. So, you may not realize that, hey, my urine flow's been off or something's up with my urination. So, you may go see your urologist for a urine issue, but you're like not realizing that this might be tied into a muscle issue because of the excessive masturbation.
Yeah, and I went because of the person that I know that had this very severe pelvic floor issue that um, you know, he had to go to many different doctors. He was misdiagnosed.
Mhm.
And so far like what are some tell me again some of the symptoms that people might be looking out for that
Yeah.
could be the pelvic floor?
Yep. So let's kind of go down the list. Okay. So low back pain or stiffness, hip stiffness, pain. Two would be any type of tensioning that you're feeling in the testicle, scrotal pain, or penis. Some people have tip of the penis pain or penile shaft pain, or any type of. The big thing that I hear is people will say gripping. There's a lot of gripping, or I feel like there's a golf ball in my rectum. That's another
Oh
one.
God.
Yeah, golf ball in the rectum type
Oh,
feeling. Another big one is
that's a visual there. Golf
yeah, yeah,
ball in the rectum.
golf
Eh.
ball in the rectum. It feels like something's pushing in there. Another big one that people will say is they have prostate pain. They feel like they have prostatitis. And so that's another big one. But yet they go to their urologist after urologist, and sure enough, there's nothing wrong. Or they've taken tons of antibiotics and nothing's really changed their discomfort. So these tight muscles can mimic prostate pain or epididymitis pain. So again, going along with testicular pain, scrotal pain. The
What's
other
up? Epididymitis?
epididymitis. Yeah, that's another one that some urologists will diagnose their patients with is, oh, I think you may have an epididymitis. Um, it's the epididymis.
My son was just watching an old Flintstones
Yeah.
episode, and Fred was trying to get out of doing something with his wife, and so he was going to act like he was sick, and he said he had a case of dippy doodleitis.
Uh, maybe that's an epididymitis. That is
uh,
hilarious. Um,
so,
Yeah. So okay. So going down the list. So we talked about prostate. Any pain in the sexual organs. And a urologist has basically said they can't find anything or antibiotics aren't working. That is probably a pelvic floor issue.
okay.
Another one, constipation or feeling like you have any urinary symptoms. So some people that feel like they have a urinary tract infection, yet all the tests come out negative, but they feel like they're peeing all the time. They feel like they can't, it takes them forever for their urine to come out. Like they're, have to really work on relaxing and think about relaxing thoughts to go to the bathroom. Or, like I said, their urine stream is off. Anyone that has that hard flaccid that we talked about, so changes in the penis. And then, gosh, there's so many. It's like I can keep going, listing and listing and listing. Um, And
Well,
then, hemorrhoids, fissures that,
mm,
that you're like, "Whoa, where did this come from?" Like, yeah, that can definitely, or even rectal pain that doesn't make any sense. The colorectals are like, "There's nothing." Colorectal doctors are like, "There's nothing wrong in the rectum. We don't know why you're having rectal pain."
hmm,
So, off the top of my head, those are the big ones. I would say the more common ones. But again, I usually tell most of my men, I'm like, if you've gone to your urologist for a problem, or you've gone to your, you know, all your doctors and no one's really finding anything going on, chances are the pelvic floor could be an issue. And specifically for men, typically a tightness issue. And I haven't even gotten to the weakness issue yet, but I should mention that. But typically, these muscles become tight from, like I said, masturbation, or just even if they started with tightness, and then for some reason, people, men, over COVID or something like that, they started masturbating. They're like, "Whoa, what is all this pain now that I've developed?" That
yeah.
could be, that could be the pelvic floor muscles now becoming a problem. They maybe they were just under the radar, but now they've spilled over the threshold, and now they've become a problem. Um,
I can't help but think of, like when you sometimes somebody's talking about somebody and they say that person he's such a tight ass, um and then you're talking about relaxing those muscles. I mean, there really is like somebody that is chronically in stress.
mhm.
They're chronically tightening their muscles. I mean, that is a real problem.
Yeah. Because what ends up happening is people who now develop these erectile dysfunction, potentially because of excess pornography, excess, yeah,
Masturbation porn.
masturbation, um, they now are stressed. So that stress, right, psychologically changes the way your nervous system now feedbacks down to tension muscles even more. And I talk about this more in my course, where we talk about the psychological aspects and the physical aspects of problems down here.
Well,
But what it does is it creates a feedback loop, and these muscles actually can become more tight because of the stress of just, and the psychological issues that develop from this. But oftentimes it could be the other way around, where people are, I kind of call, the type A personality, where you're stressed about everything, or
yes.
you're tensioned about everything.
Mhm.
Or even people who are excessive gym goers, like they'll go to the gym and they just work out and work out, and they work out their abs and they work out their butts, and they're just working out all the time, or doing squats all the time. And then they go and they're masturbating as well. That combination is no good either, because again,
Mm,
they've already had this tightness going on, and then now you add the excessive masturbation, and
huh.
sometimes it doesn't even have to be excessive masturbation. It could just be, I went and had too much sex, or I masturbated too much a little bit, and I'm not even a porn addict, and it's like a perfect storm that comes together, and now they develop these issues, erectile
Yeah.
dysfunction as well as one of these issues.
I find it really interesting that you brought up, like, maybe excessive exercise because, um, this past year, I've really focused on adding weight training, and, as a result, I've got more stiffness than normal, so I started adding. I used to really be into yoga and had kind of fallen away from it and started bringing back uh, some yoga. From what you're saying, it sounds like yoga would be a really great thing for what we're talking about here.
Yeah, I think yoga is a great way because it incorporates breathing and stretching, and depending on the type of yoga that you're doing, it can be very beneficial. Yeah, so I always tell everyone, I'm like, if you're gonna go to the gym and work out, you better have a good stretch routine, especially if you're excessively going to the gym. Again, there's so many different body types. Some people can go to the gym, work out, never have to stretch a day in their life, and they're fine. But
Right.
then you have other body types that really do need to stretch.
Sure.
Yeah.
Well, hey, let me change the topic to your recent TED talk. in Philly. You did your first TEDx talk. Can you tell us a little about that, and how was that experience? And
Yeah.
what's that? You referenced that a couple times. What can somebody learn from watching your TED talk?
Yeah, so I think I tried to make this TEDx talk. And by the way, I did it in Wilson Park. My practice is in Philadelphia, but I did it in Wilson Park, Alabama, of all places.
Oh, okay.
um, but I really wanted to start to have men start to take a little bit more of the spotlight when it comes to these pelvic floor issues, because there's some TED Talks on women issues, but not particularly also involving men. And my goal for the talk was to basically increase awareness that men, first of all, have pelvic floors and they can develop sexual problems, sexual dysfunctions because of these tight pelvic floor muscles. And so the goal of the talk was essentially to bring that into light and to also talk a little bit about how the medical world doesn't even understand these problems down there in men, as well, and how these problems can actually cause other issues in the urinary, and colorectal areas of someone. And also how posture and muscle changes, like how all of that can create, like I said, these low back hip issues that we've been talking about. Um, so that's basically what the TED Talk was about. And my hope is that as this gains more traction and people are not afraid to talk about this, that the message is passed on, because there are so many people, so many men that are having this problem. And honestly, most of my video consultations that I do, 90% of them are men, believe it or not. So I speak to so many men in all parts of the world who are having these issues, and there's such little awareness of it. And so I'm hoping that being on the TED stage hopefully makes it okay in a way to say, hey, it's okay to talk about this. And
Yeah,
there is legitimacy, and credibility now to this.
absolutely. I applaud you for your effort. The title for Hina's TEDx talk is "Pain with Sex: Insights from a Sex Mechanic," and that's TEDx Wilson Park. We will have a link in the podcast show notes for the link to Hina's TEDx talk, "Pain with Sex: Insights from a Sex Mechanic." Hina, you had mentioned a course that you have, or courses that you have.
Yeah, so there is on if you go to our website, Rebalance PT online.com, there is a particular program for male pelvic pain patients. It's called the Male Pelvic Pain Solution. Now, it's called pain because again, pain is a big general term, but it really should be called like male dysfunction solution down there. Well, I don't know. I was trying to come up with something catchy, but most of the time when people are Google searching to find our course, it's because they're having pain issues that they can't stand anymore. But really, it's called the Male Pelvic Pain Solution. And it basically takes you step by step through explaining to you why this happens, what can it cause, how everything from the mind body is important, and what should be done about that, as well as everything from all the muscles that we see in our clinic. So this course evolved actually over COVID, when we had to teach our patients what to do via video.
Mm,
And because they couldn't come into the clinic, I've been doing this for 22 years. So I just know like the common muscles that tend to be a problem and
yeah.
the things that really make a difference. So we put it all onto a course. So it basically takes you through all the major muscle groups that tend to be a problem, how to work on them yourself, and then the focus stretches that are really important for men to do. And then also how to do your own internal work if you are comfortable doing that. And then also we're going to be adding a yoga piece to that. So yoga piece on how to work on your pelvic floor. Um, And then there's also going to be a piece on the nutrition side of things, because oftentimes when you start, people don't realize how much nutrition is actually important for muscle health. So there's a nutritional side of things. And then there's also a meditation in there of relaxing your pelvic floor. So I want to say there's 50
Wow.
videos, self-paced videos on how to do this. And at some point we have been toying with adding a Q&A with me and or one of my colleagues on basically doing a Q&A. So as you're going through the course, you can ask questions and I can answer them to the best of my ability in a group setting.
And you can get the course at rebalanceptonline.com. And what if somebody wants to work with you directly, or how would someone get a hold of you?
Yep. They can go onto our website, which is rebalancept.com. So just drop the online. And all of our information is on there. And actually, if you go to Rebalance PT online, it'll say I think it says in-person evaluation or online consultations, things like that.
Awesome. Well, Hina, thank you for being here. This was really eye-opening. This was really great. I can't wait for more people to listen and watch this. Have any final closing words?
Gosh, I would say, I commend all of you who have been, on this podcast listening to this, because, always the first thing is to try and get your health under control, and trying to get these addictions under control is the first step. So I commend all of you guys. Hang in there. I know how mentally challenging this can be. And so, just hang in there and stay positive, and hopefully you'll start seeing the light at the end of the tunnel.
All right. Well, thanks again, Hina, for being here. And I'll close with this quote that you are designed for accomplishment. You are engineered for success, and you are endowed with the seeds of greatness. Go be great. Have a good day, everyone.
Are you struggling with porn addiction? Then schedule a free strategy call with Eric today at powerfuleric.com or call 314-717-0377.